Hello. Welcome to another episode of Cutting Edge Pain Relief and Biohacking Your Pain. Today, we're going to talk about the Vertiflex procedure, which is a procedure that allows for improvements of lumbar spinal stenosis. Another episode of Cutting Edge Pain Relief and be able to provide benefit in relationship to individuals who have pain that goes down their legs. I'm Dr. Orlando Landrum, an interventional pain medicine physician and regenerative medicine specialist who looks to find ways to be able to empower patients so that you can be able to improve your pain, get back to leading the lives that you love, and punch pain in the face and be able to have you take control of your life. Today, we're going to talk about a procedure that involves Vertiflex. So what the heck is Vertiflex? So let me show you exactly what it is that we're talking about. So this little guy right here is a marvel of technology. And we're going to talk about exactly what that entails. So when we discuss the aspect of Vertiflex, what we're discussing is the context of something that's called an interspinous spacer. So that sounds very fancy. It sounds like it's a major surgery, none of which is the case. It couldn't be further from the truth. So let's give you a brief overview so you can have an understanding of exactly what is Vertiflex. So as you take a look, this is the aspect of the spine with nerve roots that are quote unquote inflamed. And as you can see, it's positioned in the lumbar region that really shows and demonstrates that person that's having pain that's present in the back with pain that potentially goes down into the leg. And what we're going to show you is that aspect of flexion that takes place that can cause you to have a number of problems, particularly spinal stenosis, that traditionally would need to be treated with conservative therapy. And that conservative therapy can be a whole host of different things. So it can be everything from treating with physical therapy to being able to be treated with the elements of medication to a number of other items that might be able to provide some degree of benefit. And this is going to show you that procedure in just a second. So what you're seeing is the spinous process and the spine viewed from the left. And you can see an entry that it goes into the aspect of the supraspinous ligament. And you can see that placement of that little guy that I showed to you before between the aspect of the spinous processes. And what it talks about is what are expectations that can occur. And some of those expectations that could potentially be able to occur are you can have improvement in leg pain, you can be able to have improvement in activity levels, and that you can do a number of different things that might be able to give you some degree of benefit that you otherwise wouldn't have. So one of the things that we're going to look to do is to bring in and add in a guest speaker who can give us some information of Vertiflex herself.
Hello.
Hello, how are you, Callie?
So, how are you?
An expert in Vertiflex, are you not? You can talk to us a little bit more in depth and detail about what exactly Vertiflex entails and how it may be able to provide some benefit to patients. Can you tell us a little bit about it?
Definitely. And I think that short video did a great demonstration so patients know what to expect during the procedure. But a little bit more on, why this procedure is out there is for those patients dealing with mechanical pain. So that's dealing with pain from that stenosis. And that stenosis is going to be happening just from the wear and tear on our spine. Like as we age, we're losing disc height. The canal in my little model that you could see right here, this space is narrowing. So it's normal. And that's why we see it in patients, 60 and up. And really what Vertiflex does is it targets this area, right, to lift and relieve pressure off of the nerves. Ooh, let's get this implant back in there. Off of the nerves that are being impinged. So like Dr. Landrum said during the video, it really is for patients that have the pain radiating across the back, down through the legs. That's what we're targeting, is by lifting up this space and leaving it open. It's going to mimic the same relief you get when you have a slight bend forward. A lot of patients identify with the shopping cart syndrome. It might cause pain, numbness, tingliness when you're walking or standing for too long. And when you do a slight lean forward, it opens up the space in that canal. And it frees up those nerves. So what we're trying to accomplish with the Vertiflex procedure is give you that permanent feeling of the relief that you get when you have a slight lean forward. And similar to what Dr. Landrum showed with that video, it's done in an outpatient procedure. I'd say it's about a 30-minute procedure, and patients are walking out the same day. There's been over 10,000 patients that have been treated with this since 2016. And there's been a 90% patient satisfaction rate with a 75% reduction in that leg pain. And it's not only leg pain, it can be weakness, numbness, tingliness. Some patients say they have it from their hips all the way down to their feet. So as of this point, we see a lot of patients that maybe failed physical therapy, failed epidural injections or RF. They're good candidates for this. Even if you have gotten a fusion before, you're not exempt. So definitely if you feel like this aligns with any of your symptoms of lower back to leg pain, weakness, tingliness, it's definitely something to talk to Dr. Landrum about. As far as the post-op, I know we touched a little bit on that. Really, I like to talk to patients, and you'll experience some post-procedural pain, some incisional pain for the first 3 to 5 days. Some patients get relief right away from that leg pain and that back pain. But I really like to say, give yourself the full 6 weeks for your body to adapt to having that implant in there and for that incision site to heal and to feel the full relief. So there's not many restrictions once you get these implants in. Activities such as walking is definitely encouraged. The whole goal of this procedure is to get you to a more active lifestyle or get you back to where you were before. The only restrictions you have is just strenuous activity for the first 4 to 6 weeks. So that's any bending and lifting more than 10 pounds of weight, any significant twisting. So we'll stay off the golf course for the first 6 weeks. But besides that, there's not a ton of downtime and there's not a ton of limitations once you try this. Did I
Okay.
hit most everything?
I think you covered a lot of different topics and you really did it its due diligence. But you're super fancy. You got all the fancy lingo. You're talking, about post-operative and such. So our viewers sometimes are kind of like, well, can you break it down? So let's see if we go back through and we use some of the slides and some other things that I think you guys might have to kind of really get into this. So as I understand it, when you talk about kind of that presentation of symptoms, you have a couple different things that you can kind of show with that, right? So you could have that aspect of having some pain when you walk. You may have some numbness or tingling in the legs, like I think you mentioned before, but it doesn't have to just be in the legs. It could be in the calves. It could be in the glutes. It may be that you have some weakness or loss of balance. It may be that you have that improved sensation like you described before that talked about that aspect of what's called a shopping cart sign, right? And so I think you really elucidated that. Oh, I'm using fancy terms like you. That you really clarified, you really explained that aspect really well, which is instead of it's hard for you to sit up straight, that it's easier when you bend forward, right? And it's almost
Right.
like you're leaning on that shopping cart that opens things up. And so people are like, yeah, I get that, but how does that relate to what's taking place with us? And I think that the procedure that we're talking about doing is able to provide that natural accommodation that you have and make it be sustainable, but let you be able to lead your life. Can you comment a little bit about that for us?
Yeah, that's a great way to make it a little bit more streamlined. So, like for example, let's say this is your spine when you're standing, right? As we age, and as you're feeling the symptoms you're feeling, you know, you're having these nerves be a little bit more crushed. Now, this is just normally when you're standing, but when you lean forward, right, you give yourself a little bit more space. And then that relieves some of your pain. So it could be a slight lean or it's sitting down. And so, to your point, by putting this implant in there, it's a small implant, right? It mimics that same thing. So even when you're standing now, I could put all this pressure on here. You still have that slight opening like you did when you're leaning forward. So the implant mimics that feeling that you had when you're leaning slightly forward, because it's going to leave that space open basically as a doorstop. So that way you're comfortable standing all the way up. So I guess that would be the easiest way to describe it, is really as a doorstop. So that way, when you stand straight up, you still have that feeling that you have when you're leaning slightly forward, for that relief. Was that a little bit more simplified or still too complex?
We're getting there. We're getting there. We're
Okay.
getting there. All right. So let's talk a little bit more about some of those symptoms that I think that you have. And I know I'm doing a hodgepodge deal of showing some pictures, and I know you have fancy like professional slides and such. But I'm going to use my little hodgepodge slides that I have right now, and we'll kind of take a few questions here and there if some things kind of present themselves. But really what we're talking about, as you've really clarified, is that fancy terminology that's called lumbar spinal stenosis, right? And so exactly what does that mean? And I know that, you guys were gracious enough, because I'm not as cool as you guys with your models and stuff, but you gave me a model too, right? So
Yeah.
I got my own little piece that's present here. But when we talk about like what spinal stenosis, what we're really kind of talking about is that element of being able to say, okay, what's going on in this canal, and then what's going on within the aspect of where these nerve roots exit out from. So if we're kind of turning this and trying to show it to you in our sort of stream here, what's going on here, and then what's going on in this area in here. And can we open that space up? Can we find a way without us having to cut it, without us having to remove bone, without us having to do a lot of other invasive type of options to be able to provide benefit? And I think that's exactly what Vertiflex lends itself to. And within that context of somewhere between a 30-minute to an hour-long procedure, to really be able to get that area of the back opened up, so now you can do the activities like you really want to be able to do. And for some of the viewers who just joined us, what we're talking about is if you can't stand for a long period of time, if you can't walk for a long period of time, this is the type of treatment for you. So what I hear that comes to me in my clinic is patients say, you know what, I'm trying to stand and I'm trying to cook, or I might be washing dishes by hand, or I'm trying to walk somewhere and I really just need to sit down. And it frustrates me. What can we do about that? And I think historically the answer has been, let's send you to surgery and let's consider maybe doing something like rods and screws and possibly doing a fusion in order to be able to open up that area and then provide stability thereafter. Now, we're not saying everyone is a candidate for this, so don't mistake us. I don't think that that's what we're saying, is that this is the ambrosia from the gods, that it's like this is going to fix everybody. No, there are certain things that are a necessity for us to understand about you to be able to qualify whether you're going to be a good candidate. But if you have that problem where you're like, man, I just really can't walk, or I really can't stand for a prolonged period of time, this might be the fit for you. And the interesting thing about Vertiflex, as opposed to a number of other spinal stenosis type treatments, is that it doesn't just help central stenosis, which is what I was trying to show in a rudimentary way earlier. It doesn't just help this area in here. It also helps some of the areas in here where those nerves can be compressed. But I'm going to let the expert speak and let her talk a little bit about that kind of context. And then if you guys have questions, jump in and throw them out there. And I'm sure she can field them. And the few scraps that she has left over, I'll do my best to be able to try to do clean up duty. All right.
Yeah, that's great. So just like Dr. Landrum said, so really it's this area that we're trying to free up, right? It's not just the central area, but it's the lateral area too. These are the nerve exitings, right, that go all the way throughout your hips or down your legs. So what the implant can do by getting it placed right in between the spinous processes like that, it's able to support all the way around. So it's lifting up space, and it's not just freeing up the central area, but it's also freeing up the lateral, the sides, and the foraminal area as well, which is what is causing some of that pain, tingliness, weakness in the buttocks, legs, and preventing you from standing or being able to cook dinner and stand the whole time throughout dinner. So it is neat that there is now a therapy that can address both the central, right, this area that we're trying to free up space in, and then the impingement on the sides as well, because they all play a role. So by using the implant, we're able to free up the space and, stabilize it a little bit as well. And that's the goal, because more times than not, it's not just this central area that's backed up. I'm trying to think of a good analogy, more times than not, there's more than one thing going on, and you have to address all of them in order to get the results you want. So this allows us to address not only the central area, but then the sides as well. Moving around with this.
All right. Are there any patients which are probably not good candidates for something like this?
Yeah, that's a great question, because like you said, this isn't for everybody. And a huge, first sign that you're not a good candidate for this is when you do sit down, you don't get that relief. You don't feel any better. Even after like 5 minutes, if you don't feel any better, then what the goal of this is to open up that space and mimic that positioning when you sit down and give or lean forward. If you're not getting any relief when you lean forward or sit down, then this can't help you, because that's what this is doing. It's going to mimic that. But if the relief isn't there for you, then you wouldn't be a good candidate. If you were fused at the levels where there is stenosis or there is the impingement of those nerves, we cannot place the implant where you have already been fused. Also, if you have severe osteoporosis, we would probably get a DEXA scan and see where you're at. But if you have severe osteoporosis, we would be worried about a fracture. So
I got a question for you. I mean, okay. You started breaking out DEXA scans and starting to tell us all this. So what is that and what does it do?
The DEXA scan? So what we're trying to do is make sure that you have the appropriate bone density, so we don't risk a fracture when this gets put in, right? The goal of this is to help and relieve your pain, but if we're doing this with someone that doesn't have the appropriate bone density, then it's not going to do its job, and we wouldn't want to offer this to you. But really, if you've had a fusion before, if the bone density isn't that strong, or at a certain point, and then if you have severe scoliosis, where your spine doesn't line up like this, those are some of the key things. But really, as far as a patient, knowing if this might be a good option for you, and when Dr. Landrum assesses you, if you're not getting any of that relief, then this probably isn't the mechanical problem that we're looking to fix. So that would be number one. And then, that bone density, and then some more anatomy complications such as scoliosis or, spondylolisthesis, not to get into big terms. But if your spine isn't stable, then you probably wouldn't be the best. You might need a different type of therapy than this.
You reeled it back. You reeled it back. That was great. So as we kind of talk about this, just for people that don't tune in every Thursday, as you guys, some of you guys who come in regularly, you can be able to subscribe to our newsletter, which will talk about Vertiflex actually over the next month and a half or so, where you can find some more information, how you can be able to get some more understanding about what's taking place. And actually, I think that she may have a golden nugget for us a little bit about where you can be able to get some personal understanding about that coming up pretty soon. But as you guys also know, we have a YouTube channel where you can be able to find this video for evergreen content. So this will be posted for quite some period of time so that you can come back. And if your loved one or someone else that you know of could benefit from this, you can refer them to it so they didn't just like miss it and be like, oh, well, hey, you're out of luck. But more so you can be able to say, hey, you know what? I missed this part so I can get some better understanding about what's going on. So when we talk about, people who aren't candidates for this, I will tell you, at least to me, one of the best things about this procedure is that it's not invasive to the extent that we're going to remove something that then makes it difficult to get another procedure done. And I think that's one of the best things. And it's not a cliche. At the end of the day, we don't want to do any harm. We want to try to provide you the best benefit that you can have without having much limitation, right? So can we be able to get you being able to be active? So can you garden? Can you walk? Can you play golf eventually? Can you walk the dog? Can you do all those type of things? Not during that first 6 weeks, otherwise she'll get you. But later on, can you do those type of things that you couldn't do before? And to me, I think, I do procedures all the time that I think provide value. But I think what's frustrating for a lot of patients is they feel like they're on this roller coaster ride. They're on this cyclical episode of saying, how can we be able to feel better and have it be sustainable? Meaning, how long can it be able to last? So we got a few people that are sending in various different comments that are talking about, what's going on with them. And for instance, Vicky Woods talks about she gets relief when she sits. And I know she has some other comments that are in place, that there's some other things that sometimes take place, but this might be something for us to evaluate and kind of take a look at. And I know there's a question or a comment that she has in terms of, is it invasive like a stimulator? And it's a little bit different, but we can kind of get into some of those nuanced things if you want to talk one-on-one about how it's done and where the location is exactly in the spine. That one video earlier kind of references it a little bit. And obviously the model that we just showed shows that a bit as well. But at the end of the day, what I would say, and you can kind of tell me this if you think differently, most patients don't find this uncomfortable during the actual procedure because, as I understand it, we're going to give you some sedation in order to keep you comfortable so that you're not going to even be aware. We don't need your type of input that you'd have like when you're getting a spinal cord stimulator. So what may happen, but it doesn't happen for everyone, is that you may wake up and you might feel better because we've relieved some of that pressure that's in place so that you can be able to say, hey, I don't feel that same type of constriction. But I'll leave it to the expert and let her tell it.
Yeah, and just like Dr. Landrum said, you did a great job with that. So you are under sedation. So during the procedure, you will not be feeling anything. And similar to like you said, some people do see immediate relief. But I always am pretty cautious with what to expect afterwards. And you just got a procedure just like any other procedure. So there will be some soreness where the incision site is, but that will go away within the 3 to 5 days. But as far as like the symptoms that you had prior, whether it was leg, buttocks, back, people tend to get relief with that pretty quickly.
Okay. Do you think there's anything else that we might be missing that we need to have an understanding about? I guess the question I'd ask real quick is, so how long has this been around? And like, where did it come from?
Yeah, that's a great question. So it's been on the market since 2016, and there's been something similar like it on the market, right? And really it was, how can we address this mechanical problem? Because in the pain space, there's great therapies out there, but they were really looking for a mechanical solution, right? There's a spinal cord stimulator, there's injections, there's RF, but really we needed to open up this space and free up this space. So that's the whole goal, is what can address the mechanical problem that's going on. And that's why they came up with a mechanical solution. So that's kind of why I use the analogy of a doorstop, because really we're just preventing all of the pressure on those nerves from the central, lateral, and foraminal side. So kind of all around. And so it got approved on the market in 2016, but prior to that, there was 5 years of clinical trials. And that's where we got a boatload of our data that is out there and published, where there was that 90% patient satisfaction rate, and then that 75% relief in leg symptoms. That was all the way through 5 years. Another huge thing is that there's an 85% reduction in opioid use at the end of the 5 years, where it was either complete reduction or zero use of opioids after the 5-year mark.
All right, wait a minute. So people are able to decrease their meds by 85%. Is that the case?
Yeah.
I mean, that's huge. I think there are tons of people who are out there like, you know what, I want to get off of meds. And the reason why I use meds is not because I want to, it's because I have to in order to be functional. And I know that a number of patients say, you know what, maybe we're kind of missing some things when we think about, are we looking at pain or are we looking at function? And it seems like this product may be able to kind of address both.
Right. Exactly. And that's especially when I'm talking to patients beforehand, more times than not, I hear a lot of patients say, I just want to get off my pain meds. So it is great to know that 85 there, with that 85% reduction, there is a high hope that you won't need those pain medications to manage that lower back and leg pain or symptoms that you're having after you get this procedure done.
Okay. So if people wanted to kind of jump on a call and they wanted to like have a discussion, do you have something that might be of that ilk where they can be able to have a bit of a discussion where they could sit down and have either a Zoom call or something like that?
Yeah, what a great idea. We actually do a Vertiflex class every other Tuesday. So I could send out, oh, look at you. You have all the information right there.
So this is what you have, right? That I believe that you have in place.
Yeah.
And so we just missed one, I want to say a few days or so ago, but there's still a number of them still left that are going on for the rest of the next couple months. And I want to say it continues, but you really, if you're interested, want to reach out and get some insight about what's going on, how to be able to understand exactly what's taking place so you can get your personal questions answered. So if you had something where you said, you know what, I have a stimulator and I have some pain that's present in my SI joints, as I think one of our patients is talking about, and is curious about how that might have some effect or some benefit, or would it have any impact whatsoever? Those are things that I think you can ask on an individual basis, and you can get some of those questions really kind of delineated. Or if you had a fusion in one level and you said, but that's not the level that's causing me problems, I love a treatment at another level, is that something that might be able to give me some benefit? I think that type of presentation may be able to give you some of those answers.
Definitely. So it goes into Vertiflex, just like Dr. Landrum said, like a little bit more of a presentation and a little bit more in depth. But throughout the whole webinar, you're able to type in your questions and we answer them along the way. So it's kind of like open for discussion, and then you have contact information afterwards. So if you had any additional questions after the presentation that maybe came up when you were talking to a spouse or a friend, you can always reach out to us afterwards and ask those questions and get some answers.
Okay. Thank you so much. So I think we've answered most people's questions. I think we've given a heck of a overview to what Vertiflex is and been able to get into some of the aspects of the granular nitty gritty components of how it impacts spinal stenosis and foraminal stenosis. And then you came back and you broke it down so that people are like, all right, I understand exactly what stenosis is. I understand how this is of benefit and how it can be able to help us. And then also provided some resources about next steps. If I want to get some more information, how to be able to get that information, where to find it, and then what exactly does that mean? Is there anything else that you think you'd like to add to be able to provide value to patients that you think would be useful?
I don't know if you have the website, but there's a livingwithlss.com website, and it gives your patients the option to opt in. And then a patient specialist, patient education specialist, can reach out to the patients once they opt in.
Let's see if maybe we can find something like that. If you're telling me that that's the case, hold on a second and see if we can be able to pick that out.
Yeah, that would be probably the next best step. There you go.
How about that? So as you stated, living with LSS, and it looks like you can be able to kind of come down here, connect in,
Yeah,
get a further understanding about what's going on, and really get some ideas about how you can be able to take action and move forward from there. Does that sound about right?
that's perfect. It's a great resource, and once you opt in, it gives someone from the company permission to reach out and educate. But really, just from the website, there's going to be a Q&A page, and some of those common questions that you might think like, oh, this is maybe answered or something, I'm sure it's going to get answered on there, but it just gives patients another resource to learn more about it and feel a little bit more comfortable about it.
Perfect. Okay, well, thank you so much for joining us, for teaching us about what's going on with Vertiflex and spinal stenosis and how to be able to have people get back to doing the things that they love, how to be able to punch pain in the face and get back to doing the things that they really want to be able to do. Thank you so much for your time. Everyone have a great day.
Thanks for having me. Bye.